better health is central to human happiness and survival. One of the things that we recognize here at ICCR is without your health, you can't be a productive member of society. So we have a group of shareholders here who believe that access to healthcare is a human right. So there is a moral obligation for the investors to help pressure companies, but pressure in a way where there's a mutual understanding and dialogue around how to improve health. Here at ICCR, we use shareholder advocacy as a lever to improve health. We recognize that there are a variety of different stakeholders who play a role in improving health across the world, and in particular, shareholders here who are members of faith-based organizations, they're asset managers focused on responsible investing, pension funds, that they actually have influence with the corporations in which they hold shares. So what we try to do is really engage these companies around dialogues to try to figure out how they, as a corporation, can actually change their corporate policies to better improve health throughout the communities in which they serve. Some of the other areas where we focus at ICCR: human rights, water, access, financing, ethical recruitment. You could say that, at least in the health space, we focus directly on companies that focus on the healthcare sector. But what I would argue is that really a lot of what we do here at ICCR is broadly looking at health. So you're looking at social determinants of health. Social determinants of health are basically where you live, work, eat, and play influences your health status. So while we're focusing indirectly on the different influences of health, the work within the health space directly is focused on access to healthcare. And when I say access to healthcare, I mean, is there a health system in which you can engage? Do you actually have the ability to access that healthcare? So is it is it close to where you live? And then third, are the providers in which you're accessing in tune to your personal needs as a patient? So are you able to sort of develop a personal relationship with the providers who are providing you with care? Here within the health work, while those are the three areas of access, our main focus really is once somebody has been diagnosed with a certain disease. So sort of on the treatment side, or what we would call secondary or tertiary prevention. So the areas where we are currently focusing our efforts have to do with drug pricing. So our patients actually, once they're diagnosed with a certain disease, able to get access to the treatment that they need at an affordable cost. So that involves working with companies to try to understand what is their strategies around drug pricing. Are they transparent about their lobbying efforts? And most recently, we've really put together some resolutions that look at the connection between executive compensation and drug pricing. Outside of drug pricing, another area is really focusing on the opioid epidemic. So trying to understand and have dialogues with not just manufacturers and distributors of opioid drugs, but also some of the companies that are working on opioid addiction treatment. So really understanding or moving them towards having better oversight to sort of address the misuse of opioids. In terms of global health, what we're focusing on is really trying to increase access in the developing world, in both low-income and middle-income countries, to vaccines and drugs. So knowing that there are certain countries that bear a disproportionate burden of disease, really trying to make sure that those countries have access to the medicines that they need most. The fourth part is really focused more on access to nutrition. So our work there really looks at three different sectors: the restaurant sector, the retail sector, and the food and beverage sector. And within the food and beverage sector, what we're really trying to do is make sure that there's transparency around marketing, around certain types of foods. It's also making sure that folks are participating in the access to medicines or access to nutrition index, which is an indice that sort of uses metrics to compare companies. Within the restaurant sector is really trying to understand or to push forward responsible menu development focused on children. So when children come in and they order a meal, are you getting the calories down as far as you can? What are the offerings, the default options? And then third, within the retail sector is really looking at choice architecture. So when someone goes into the supermarket, are they actually being confronted with healthier options instead of non-healthy options?